Your doctor writes the prescription, but the one deciding what drug you get and what you pay for it isn't your doctor. It's three companies you've never heard of: CVS Caremark, Express Scripts, OptumRx. 80% of every prescription in America goes through these three. Last year, a U.S. congressman asked the CEO of CVS Caremark why a $16 generic for multiple sclerosis ended up costing patients $6,229, a margin of 38,000%. A Fortune 10 company by U.S. revenue, earning that off a single pill. But this isn't a story about margin. It's about structural damage to America's drug supply chain. First, independent pharmacies are closing, 7 a day. Second, one kid in Wisconsin, Cole, charged $500 for one inhaler. He couldn't afford the next one. 5 days later, he was dead. Third, the documentary that named them disappeared from the internet last summer. It's not that the government is doing nothing. February 2026, Trump signed PBM reform, H.R. 7148. April 2026, Tennessee banned PBMs from owning the pharmacies they pay. But the price hasn't moved yet. Today, structure, damage, what comes next? On one table. We trace where things go. So who are these three companies? Pharmacy Benefit Managers, PBMs. They're the middlemen, sitting between the patient, the insurance company, the doctor, and the pharmacy. PBMs don't make the drug, they don't dispense it, but they decide what drug a patient is allowed to get and what it's going to cost. The Federal Trade Commission, January 2025, confirmed it. The top three handle 80% of every prescription in this country. Not most, not the majority, 80%. That's an oligopoly. They don't make, they don't dispense, they just decide. So how do they actually make money? Three mechanisms. They run at the same time. First, spread pricing. Mechanism. The PBM pays the pharmacy a low rate, then bills the insurance company a high one. They pocket the spread. Example, same generic pill. Pharmacy gets paid $8, insurance pays $50. The $42 in the middle goes to the PBM. Structural result. Neither the pharmacy nor the insurance company sees the gap. It gets passed back to patients in higher premiums. The FTC tracked 6 years of this. $7.3 billion in excess revenue from spread alone in one specialty generic category. Second, the rebate game. Mechanism. Drug list prices are inflated on purpose. From that inflated price, the manufacturer kicks back a rebate to the PBM. Example. A vial of insulin gets listed at $300. The manufacturer hands $200 of that back to the PBM as a rebate. The patient still pays the $300 list price. $200 of it goes back to the PBM. Structural result. The higher the list price, the bigger the rebate. So list prices don't come down, they go up. Third, formulary control. Mechanism. A formulary is the list of drugs your insurance covers. The PBM writes the list. Example. Anyone who filled an Ozempic or Wegovy script this year saw this firsthand. CVS Caremark named Wegovy preferred, then dropped Zepbound from the list entirely. Millions of patients lost coverage overnight. Structural result. Which drug is on, which drug is off. One company decides. Spread, rebate, the list. When all three run at once, a single drug can post a margin of 38,000%. The pharmacists who live this, the patients who pay it, and one documentary that put a name on it. They call it modern medical mafia. But margin alone doesn't explain 1,000%. And it doesn't explain what happened in February. Now, back to the question. How did three companies get to 80%? PBMs started in 1968. just paper claim processors doing the math. By the 1990s, dozens of them, national. Then the 2000s, they started buying each other. 2007, CVS bought Caremark. A pharmacy chain and a PBM became one company. 2012, Express Scripts bought Medco. The two biggest PBMs merged. 2015, UnitedHealth folded its PBM operations into one platform, OptumRx. 2018, Cigna bought Express Scripts. Now an insurance company owned the PBM. By the end of 2018, 3 insurance companies, 3 PBMs, 3 mail-order pharmacies, all under one roof each. 80% of every prescription in America. That's not competition. That's an oligopoly. When 3 companies effectively control the entire pharmaceutical supply chain, the whole American drug ecosystem starts to crack. So what happens to the people behind the cracks? So that was the structure. Mergers, oligopoly. Now the damage. 3 kinds. Patients, pharmacies, the truth itself. Patients first. Specialty generics. Drugs for cancer, HIV, multiple sclerosis. Drugs patients can't refuse. The FTC found markups averaging 1,000%. Highest single case, 7,736%. That was the average. But the part that didn't make the headlines, July 2024. Congressman Jake Auchincloss asked CVS Caremark CEO Karen Lynch why a $16 MS drug ended up costing patients $6,229. 38,000%. 2 months later, September 2024. Same congressman, same company, same drug. The price had gone up. 47,000%. 9,000% more, while a sitting U.S. congressman was watching. January 2024. A 22-year-old in Wisconsin. His name was Schmidtknecht. Asthma since he was a kid. His inhaler, Advair Discus, had cost him $70 for years. Then his PBM, OptumRx, quietly changed the formulary, the list of covered drugs. No warning. The pharmacy told him $500. He couldn't afford it. He left the inhaler on the counter and walked out. 5 days later, a severe asthma attack. Cole died. The FDA didn't change. The drug didn't change. Only the list changed. One company changed the list. His parents are still in court. One patient died. The mechanism that killed him is still running today. Independent pharmacies are closing at 7 a day. In low-income zip codes, 3 to 4 times that rate. There's a name for it now. Pharmacy desert. How does a PBM kill an independent pharmacy? It doesn't have to do anything dramatic. It just pays the pharmacy less than the drug costs. Mechanism. The pharmacy buys a drug from the wholesaler for $10. The PBM reimburses $8. Every script, the pharmacy loses $2. Multiply that by every script in a month. The pharmacy closes. When the local pharmacy closes, the patient doesn't choose what comes next. The patient gets pushed to a PBM-owned mail-order pharmacy. CVS Caremark owns one, Express Scripts owns one, OptumRx owns one. The same company that just killed the local pharmacy now ships the same drug from a warehouse. 1-star reviewed mail-order pharmacies. Patients are pushed in anyway. The pharmacy didn't fail. The pharmacy was beaten. Beaten by the same 3 companies that now sell the same drug through the mail. Patients pay more. Pharmacies close. The company that decides both? Same 3. CVS Health margin? Up. Cigna margin? Up. UnitedHealth margin? Record highs. Same year, same 3 companies, 7 a day. Last summer, a documentary went up on Amazon Prime, then Vimeo. It was called Modern Medical Mafia. It interviewed pharmacists, patients, Cole's parents, independent pharmacy owners. It named the three companies, on camera, with evidence. 1 month later, gone. The footage didn't disappear because it was wrong. It disappeared because it was true. UnitedHealth, OptumRx's parent company, sent a legal letter, more than a dozen pages. The New York Times reported it on July 12, 2025. Amazon pulled it. Vimeo pulled it. UnitedHealth's lawyers called the documentary misinformation. The doctors in it called it the truth three companies didn't want anyone to see. The Streisand effect. The harder you try to erase something, the more people search for it. The Times itself reported the takedown. Patients, pharmacies, the truth itself. 3 damages, 1 source. So where did the money actually go? Here's where the trace gets weird. If 3 companies are pulling billions in excess revenue, where does the money actually go? Hunterbrook Media tracked it. January 2026. Their report, they called it bullshit. Their word, not ours. Subtitle: The New Way Health Giants Hide Billions. The answer is Group Purchasing Organizations, GPOs. PBMs don't buy drugs in the U.S. anymore. They buy through these GPOs, in countries with names you can't pronounce and laws you can't sue under. CVS Caremark uses Zinc Health Services. Zinc is registered in the Cayman Islands. Express Scripts uses Ascent Health Services. Ascent is in Switzerland. OptumRx uses Emisar Pharma Services, also Cayman Islands. 3 companies, 3 offshore middlemen of middlemen, 3 jurisdictions the FTC can't subpoena. The FTC subpoenaed documents. Zinc, Ascent, Emisar, all 3 said no. They're not in America. The documentary disappeared, but one piece of the truth came back in the Hunterbrook report. So we put a name on this. Last episode, we traced chocolate, found a pattern. The farmer loses, the consumer loses, the middle wins. We called it both ends extraction. The pharmacy industry is the same shape, different aisle. On one end, independent pharmacies bleed, 7 a day. On the other end, patients bleed. Cole's inhaler, cancer copays, premiums up 21% last year, the steepest jump NCPA has ever tracked. The middle? Big 3 margins, record highs. Both ends bleed. The middle goes up. We have a name. The question now, does anyone actually fix it? February 3, 2026. The Trump administration signed PBM reform, H.R. 7148. It's bipartisan, sponsored by Jake Auchincloss, Democrat from Massachusetts, and Diana Harshbarger, Republican from Tennessee. That's how you know somebody's been bleeding for a long time, when both sides agree. What it does, PBM compensation can no longer be tied to drug list prices in Medicare Part D. What it doesn't do, that rule starts in 2028, 2 years from now. February 4th, the day after, the FTC settled with Express Scripts. $7 billion in promised savings over 10 years. Insulin only. CVS Caremark and OptumRx aren't bound by it. Last week, April 22nd, Tennessee passed a law banning PBMs from owning the pharmacies they reimburse. CVS is already suing Tennessee. And the offshore GPOs? Zinc, Ascent, Emisar? Not in this reform. The law passed, the settlement happened, the state pushed back. The price still hasn't moved. Will it work? Maybe. Eventually. Cole's parents are still in court. But every piece you just saw, that's why we put it on the table. So when the next law passes, you can read what it actually says. Here's what to do. 60 seconds. 1. Open GoodRx. Compare what your prescription costs there to what your insurance bills you. If the gap is huge, that gap is the PBM. 2. Mark Cuban Cost Plus Drugs. 20,000 drugs sold without a PBM in the middle. It's not charity. It's just what a price looks like with 3 companies removed from it. 3. Next time the pharmacist says, "We don't carry that," ask if it's a formulary issue. That word, formulary, is the list. The list one of 3 companies controls. 4. This trace doesn't survive in your head. It only survives if you send it. Send it to anyone whose copay just went up. Save it. Show it to your pharmacist. The documentary disappeared. This one might too. The trace lives where you put it. Don't argue with 3 companies. Just read, then send. We traced one thing today: the money inside the prescription. It didn't go to the pharmacist. It didn't come back to the patient. Some of it went to a building in the Cayman Islands. Some went to a vault in Switzerland. All of it ended up somewhere a U.S. court can't reach. 3 companies decide what drug a patient gets. And in 2025, they decided what the public gets to know. Modern Medical Mafia tried to expose this. 1 month later, it was gone. So here's what we do. Don't keep this in your head. Send it. Save it. Show somebody. Next time 3 companies decide what a patient can afford and what the public can know, we'll have already read the receipt. We trace where things go while they still exist.